Thank you very much, ladies and gentlemen. It is needless to say that it is a great honor for me to be here today, given the opportunity to tell you more about the activities of my organization, the World Health Organization, in the area of Roma health. And it is also an honor for me to be able to talk about the interagency coordination initiative on scaling up actions toward the Millennium Development Goals 4 and 5 in the context of the decade of Roma inclusion and the EU national Roma integration strategies. Thank you very much for the invitation. I structure my presentation in 3 parts. I will very shortly talk about the background, context, and the rationale for this project, continuing to talk about its aims, objectives, partners, and other collaborators involved in the project. And finally, I will talk about what exactly we are doing and all partners are doing in the project or plan to do in the project, and what products that we have already produced or plan to produce during this biennium. It is probably not a big surprise to you sitting in this room that UN agencies take the improvement of Roma health and living conditions of the Roma population and other populations experiencing social exclusion and poverty very seriously. I just would like to remind you that one of the main purposes of the United Nations is to help nations work together to improve the lives of the poor people, to conquer hunger, disease, and illiteracy, and to respect and encourage respect for each other's rights and freedoms. There are numerous UN resolutions and also World Health Assembly resolutions that encourage member states and also the secretariats of the UN agencies to work towards this aim and improve the living conditions and health conditions of poor people. And this work is very much inspired by the Millennium Development Goals, and you will all know very well that many of the actions called for in the decade action plans and the EU national strategies actually support the progress towards the Millennium Development Goals, and especially Millennium Development Goal 4 and 5 on child health and women's health. MDG 4 is about reducing child mortality. It's reducing infant mortality, under-5 mortality. It's also about vaccination, immunization against measles. Just to mention a few examples, or MDG 5, reducing maternal mortality. It's addressing contraceptive prevalence, unmet needs for family planning, and also, of course, maternal mortality. And today it is absolutely clear now, based on evidence, that many socially excluded populations lag behind in most MDG areas, not least in the areas of child health and maternal health. There is very clear evidence now that we have unacceptable health inequalities and inequities for Roma women and children. And I just picked a few examples. I could list many more examples here, but for example, previous UNDP studies show that in Bulgaria, Romania, child mortality among Roma is significantly higher than the national averages. In Serbia, the probability of a child in a Roma settlement dying before the age of 5 is 3 times higher than the national average. In Macedonia, show that Roma mothers often lack health insurance and cannot afford regular antenatal care, delivery, and postnatal care. And there are many, many more examples. I just came from another meeting which was held in Milano by the European Health Association, Public Health Association, and its section on migrant health and health of ethnic minorities. And I just listened to a presentation by a representative of the Council of Europe, and what he presented was an overview of Roma health and trends in health development. And it was absolutely shocking because the differences between Roma and non-Roma on many health indicators are not improving, not stagnating, but it's actually worsening. And in Central and Eastern Europe, we can see a very rapid deterioration of health and increasing gaps ever since the 1990s. So the situation is really very alarming regarding the health development of Roma people in many, many countries. So about the initiative, I mean, it's absolutely makes sense that UN agencies work together. There is a strategic value of working together on Roma health. Because this initiative will facilitate the joint planning among involved agencies of activities on Roma health and optimizing the synergies. We can also avoid duplication. Of course, it's good also for resource sharing in these times of economic crisis. We're all struggling for economic resources to be able to implement our programs and strategies. So we can resource share also in financial terms in terms of staff. And that way we can make limited resources go further. We can also create, by collaborating, a platform for a common position among the involved agencies on Roma health issues. And we can together identify the funding gaps and also the opportunities for joint fundraising. And of course, what we are doing is very much synergizing with the European Union and the decade of Roma inclusion processes. So we follow these processes and also collaborate both with the European Commission and the decade. So the aim of this initiative is to build the capacities of governments and other stakeholders to monitor and deliver on the health components of the national Roma integration strategies and also the decade action plans. And the focus is, as I said, is on Roma women and children addressed by MDG 4 and 5. We're focusing on the decade countries, plus invited are also Kosovo, Slovenia, Republic of Moldova, and Turkey. And the time fair is from now to December 2015. We have work objectives at 3 levels. At the European level, we would like to provide evidence, resources, and also inter-country platforms to strengthen the capacity of member states and other stakeholders to scale up and monitor action towards MDG 4 and 5 for the Roma population. Of course, we have the country work objective. We would like to support the Ministry of Health and other national authorities and stakeholders so they can implement and monitor the decade of Roma inclusion health action plans and the health components of the EU Roma integration strategies. And we have, of course, the stakeholder coordination objectives. We would like to improve the coordination among the multilateral system, the EU civil society, etc. So the partners we are working are, it's the Office for the Human Rights, the High Commissioner for Human Rights, UNICEF, UNDP, UNFPA, and WHO is a coordinating agency here. We are facilitating the linkages between the different products, and we also having as partner the International Organization for Migration, which is a multilateral system partner. And we expect also technical input from ILO, the United Nations Economic Commission for Europe, and we have other collaborators, including the EC, WHO Collaborating Center, OSF, International Planned Parenthood Foundation, etc. So what are we doing concretely? UNDP, as you could hear as well, will provide quantitative data analysis and publications on health, focusing on MDG 4 and 5, drawing on the survey they are doing. The IOM has kindly provided this slide to inform you about their program on fostering health provision for migrants, Roma, and other vulnerable groups program, working together with the European Commission, and they will focus on the Roma and other vulnerable ethnic groups, including also the irregular and illegal migrants. WHO is currently producing a resource package and preparing multi-country capacity building events for reorienting MDG 4 and 5 strategies. And we also produced, in cooperation with the European Commission and the University of Alicante, Roma Health newsletter, and you received a hard copy of it, which I hope you will find useful. It's an electronic newsletter. You can subscribe to it to get automatically the next issue of it.